Hi, my name is Mark Widgery. I'm a GP and one of the MedLink co-founders, and I'd like just a few minutes to show you around the MedLink Automated Recall product integrated with the Vision clinical system. Just to put this in a little bit of context, we are currently live in about 220 practices covering 2.3 million patients across the UK. We've done a lot of integration work with Crown Commercial Services, G-Cloud framework, as well as various third parties, but most importantly, the Vision clinical system to allow us full integration for vision practices in Scotland. This is just trying to give a bit of a framework to the MedLink Automated Recall system. So looking at how we automate the search function in terms of identifying patients who need reviews, and then get invites into patients' hands to allow them to engage if they want to in an online review of their long-term conditions. How we get that data back into the practice for a clinician assessment and code all that data into the record for your purposes. So we're going to take each one of those in turn. So looking first of all at the searches. When we say searches, we're not providing you with clinical system searches to run within Vision. What we're doing is actually using our interaction with Vision to be able to analyze the patient record within their month of birth. We use birth month just as a way of cohorting patients and spreading the work throughout the year to avoid large peaks or troughs in workload. So within each patient's month of birth, on one day we analyze their record and look for all conditions and medications requiring review. That's determined by your settings, so you can choose to include or exclude certain conditions from the recall system. And at the same time as we analyze it for the individual conditions, when a condition is due according to your settings, we determine whether or not they need additional what we call physical checks, bloods, urine ACR, and foot check. This process is customizable. We know that for some patients, online reviews may not be appropriate and they may not fit into the automated system. And so you're able to exclude certain cohorts of patients like care home patients, housebound patients based on coded data from the automated system. The aim of this analysis is, whereas with this typical search, we're ending up with a particular parameter and we're ending up with a list of patients for that particular review that's needed. What we end up with is for each individual patient a list of outstanding conditions that patient needs reviewing. And we use that information to build a personalised online review for each individual patient, covering all of their outstanding recall. Once we've done that analysis, we then want to get the invite into the patient's hands. And again, we want to do that in a way that is automated for you, that doesn't involve, so we're not providing you with lists of patients, we're actually doing the analysis and sending out the invites on your behalf. We do that based on communication details that we pull directly out of the record. That might be email or mobile phone number, and we can actually also place automated voice calls to patients' landlines if the email and text message option is not available. This is what it looks like with the email. Obviously the SMS is slightly shorter, and what it contains is instructions for the patient of what's due, and particularly the link to their own personalised online review for all of their conditions. We'll look in a few minutes at what that looks like from a patient perspective. But at the same time as we send that invite out to the patient, we want to make sure that all of that data, the outcome of the analysis and the invite itself, is coded directly into the Vision record. So this is what we call our recall status consultation. It's a record of the analysis that we've done. So it has a line here for each individual condition, diabetes and asthma here, that are either due or excluded for any particular reason. So we're putting in here the logic of the outcome of the analysis. Also based on your settings, whether the patient is due a blood pressure check, urine ACR, blood test, foot check. And then we also include codes for the invitation that's been sent out, as well as the way we've communicated with the patient and a copy of their link that's been sent out to them for their online review. The aim of this is that although we want to make online reviews available to patients, the system isn't built entirely around them using that. What we want to make it is as comprehensive as possible for you. And so if a patient receives their MedLink invite and chooses not to engage online, which some patients won't, the majority will, but some won't, and they decide to call the practice and say, hey, I received an invite, I want to arrange things in person as normal, then your staff have got written inside the Vision record a precise outcome of the analysis that we've done based on your settings. And so your staff have got everything they need to be able to arrange appointments as necessary for that patient. We provide you with a dashboard that shows an overview of the annual recall system. You can see here the status of the practice halfway through the month of January. And so what we do is we just split the patient list into the birth month cohorts, and you can see here the progress. We send out invites on each business day of each working day of the month, so we don't send out invites on weekends or public holidays. Once that month is complete, we actually then make available to you a CSV, which is a spreadsheet formatted document that you can download. And that gives you a record of all the work that's been done and any outstanding work that might need some further input by your staff. It has a list of all the patients who've been invited, although all of that data is written to record and the invite's been sent. We actually send a second invite to patients 2 to 4 weeks later if they haven't engaged online or contacted the practice and completed their review in person. But most importantly, within the CSV, we also provide a list of patients for whom further input might be necessary. And these are patients who were not invited as part of the automated system. It's really split into two cohorts. The first group is those who've been excluded from the system by virtue of your settings, and it may be that some further proactive work is needed for those patients. The other possibility is a small group of patients for whom there were no contact details available at all, or who had contact details but had actually had a lack of or expressed dissent or lack of consent for use of those communication details. So we check for consent codes for communication as well. And so what that leaves you with is a small proportion of patients, typically 1 to 3% of your patient population, who might require some further manual input, but the vast majority of patients have received at least 1, 2 invites if necessary for their online review. So we've got that invite into the patient's hands. So we're going to look briefly now at what that looks like. What's the patient experience in terms of if they do decide to engage then with the next step of the MedLink process, which is an online review. The aim of the MedLink process is that what we found in the past when we were just dealing with individual condition invites was that it ended up being quite a bitty process for patients, that they would have one review and then they'd have another one a few months later, and it would often have some overlap, but particularly in terms of things like medication review, lifestyle questions, and any sort of crossover elements, and it made for a lot of repetition for patients. So the aim of combining this into a single review is that for patients you have a one-stop shop, single annual review covering all of their conditions, which reduces any of the duplication. So we've included in here all of the conditions here in the left-hand column, all of the chronic disease reviews, medication review, and significant mental illness, as well as specific medication reviews for pill checks and HRT. There are some of the MedLinks that we have. We still have individual condition MedLinks available for all of them, but on the right here are those MedLink reviews that don't really fit into the annual process. So a sort of episodic postnatal review or a depression review. And so those still require manual invites to be sent out. But everything on the left here typically can be managed via the automated system. So when the patient clicks on the personalized link from their invite, this page loads directly on their device, and this can happen on a smartphone, on a tablet, or on a computer. One of the beauties of MedLink is the ease of access. For the patient, it just loads inside a browser on their device. There's no download, registration required. It's a very simple process. The first page they come to can be customized by you as a practice. You can see here a banner. This is from our own practice, our senior partner standing in front of one of the buildings, just saying, "Welcome to our online system. Hope you find it helpful." It's just a way of reassuring patients with the customization that it's come from you and maximizes engagement. The patient simply enters their date of birth to confirm their identity, and that takes them into this central kind of navigation screen. So what we've done is taken the individual condition MedLinks that we've created and have been used over many years and extracted from there any elements that are common across multiple conditions. So that's lifestyle questions, medication review, blood pressure submissions. That's all then in this additional section, and so the patient then works through all of the individual condition questions, in this case aspirin diabetes, and then the appropriate additional sections. It's a way of dealing with multimorbidity, allowing the patient to manage everything in one sitting. From the beginning of MedLink, we wanted the online reviews to be more than just a quick tick box exercise online questionnaire. We felt uncomfortable if, for example, an asthma review was just, here's your ACT score, and that's all that's needed. We wanted to make something that was much more engaging for patients, much more useful for them. And so, for example, here a patient enters the type of inhaler that they use, if relevant the spacer, and then we show a video to them that's relevant to their inhaler regime and that helps reinforce inhaler technique. So we wanted to give relevant information to patients as well as gathering the important information and asking patients relevant questions. At the end of the reviews, we ask this sort of question: anything else to add about your pill check, asthma review, whatever it might be, and then we ask a question about whether you'd like to discuss things further or whether you're happy for this online review to complete the whatever review it is without further discussion if appropriate. Now this is really important for MedLink. We didn't want the system to be something that made patients feel like we were keeping them at arm's length or didn't want to interact with them. So the way MedLink is structured is we send them an invite, we say your review is due and here is an online option should you choose to engage with it. And if they do choose to engage online, we then ask them at the end of that review, would you like to discuss things further? So patients always feel that sense that the practice is happy to interact with them face-to-face or by phone if necessary. But in reality, about 70 to 85% of patients choose that second option, and depending on the patient cohort and the specific condition. And so that gives you information as a practice. We're not guaranteeing the remote review will be appropriate for the patient, but we're asking the patient if they'd be happy for that to be the case. Once the patient's actually answered all the questions and submitted their response, bear in mind that we've not just analysed the record looking at which conditions are relevant within the review, but also whether they need additional physical checks, blood test, foot check, UNACR. And so once they've finished that review, then the patient is prompted to then arrange appointments. And you're able to configure this within the settings to give patients instructions, for example, here about how to arrange a UNACR. Importantly, you're also able to configure online appointment booking as well for some of the appointments. And so if you are performing blood tests and foot checks, say inside the practice, our system will interact with yours, download the slot types, and you can specify exactly what appointment type the patients need to book into. So it's a way of patients booking into your appointment system without having to call reception. You can just give patients instructions there as well, and so it might be if you're using something like a CTAC service that you can signpost them to the relevant place for those appointments to be arranged. And we also provide a way to actually download a daily digest of all of the patients who've been invited in case you need to do lab requests in advance for those appointments. At the end of the review, we signpost patients to relevant resources, and that works out of the box. It doesn't require customization, but you can go in and enter links to local resources, smoking and alcohol services, weight loss, psychological therapies, if relevant for you. And so it just makes it a more engaging experience for patients. And we also have a social prescribing module, which you can activate and put in details of any local social prescribing services. So that's just a quick view through the patient experience of the MedLink online reviews. Now bear in mind that we've got to this point in the proceedings, and other than the initial setup of the recall system, which takes between half an hour to 45 minutes, and we can actually sit with you on a Teams call and help get that set up. Other than that initial setup, so far your staff, admin and clinical, have had nothing to do. We've run the searches, identified the patients, sent out their invites, engaged them with an online review. The one part of this 5-step process that we cannot do, and frankly will never do on your behalf, is this one here, the clinician assessment of the patient responses. Now this is really important. MedLink is not an algorithmic or automated decision-making process. We are not taking your patient data and making decisions on your behalf. We simply don't want to do that. We don't see that as our remit. Our aim is to be a data gathering service, and then we present that data to you. We do some simple analysis on it in terms of averages of blood pressures, for example, and calculating a BMI, but we're always giving you all of the raw data and some calculations to enable you to make good and efficient clinical decisions and carry them out. And that's the process now that we're looking at in terms of the practice perspective, what comes into the practice, how it does so, and how you can carry out those decisions. For each review, there are essentially 2 options for the data coming into the practice. We've created our own inbox, which is the primary way that information comes in that you have access to just via a browser on your practice computers. But we're aware that for not every practice, and certainly not every clinician, may want to deal with a new inbox and a new method of working. And so we've created a kind of halfway house, what we call autocode and email. So the background to this is, in the past, before we had integration with Vision, we would put all of the patient data into a PDF document format, email that into the practice, and it would then be pulled into the Vision filing list, might go into DocMan or however you manage your incoming correspondence, and those codes you can see on the right there would be manually added to the record. The autocode part of autocode and email is that we still do that. We send it into your email, it goes into your existing document workflow, but we also, at the same time as we send the email, code all of the data into the Vision record. So the document arrives, it's put into your existing workflow, sent through to the relevant member of staff, and then the clinical decision is made in front of DocMan or a similar piece of software, looking at that patient response and following up with the patient using your existing communication tools. So that's autocode and email, but there's no manual coding entry required there. Now that is the least functional of the 2 options, but it's the easiest to implement because there really is no system change required. We recommend, however, that the time spent in investing in the use of the MedLink inbox is well worth it, because as I'll show you just now, there is significant additional functionality that you can, that your staff can do when looking at those clinical responses. So here you can see an example, just some dummy data from the inbox itself, that the general principle of MedLink is, although the patient's doing a one-stop shop annual review covering all of their conditions, when those responses come back into the practice, we're well aware that in most practices, different clinicians within the practice will deal with different conditions. And therefore we separate them out into the relevant conditions. They're still linked together and you can still see they're from the same patient, but you can then manage them and workflow them separately, both in terms of the document via autocode and email, and also within the inbox. So you can see here each individual review. These have come from the same patient, and you've got patient details and how long they've been in the queue here. This physical checks column is a really important advantage of the inbox system, because what I want as a clinician when I'm coming to a review like this is I want not just the patient responses, but I want all of the relevant information for me to make a clinical decision. I want, with diabetes, I want the A1C result, the ACR. I want to know what the foot check result has been when it's been done, say with the HCA. And it's what's really frustrating is to come into most of the information I need and have to then arrange it and come back. And so our system inside the inbox will actually identify that those physical checks are due and the patient's been asked to arrange those appointments. But frankly, I don't want to see that response until they're all available. So I would normally filter this list and exclude anything that has pending physical checks. And so that would then disappear from my view. Our system looks 3 times a day and analyzes the record looking for those codes of the foot check, the ACR, the A1C. So once they're back from the lab, all those codes are entered into the record manually. Our system identifies that that pending physical check has been completed, and once they're all completed, that will then show in my list here. I know then that when I go into that diabetes response in this case, then I will have all the information available to make my clinical decision. So when I click into one of those lines, we'll look at the asthma just now. On the left, I've got the patient submitted data. On the right, I've got my workflow action section. So we'll just zoom in and take a look at those in turn. This just gives me the information that the patient submitted. So this is the same information that you saw on the document a little bit earlier. It's just in a slightly different format. The blue ticks indicate coded data. The light blue here shows information that's been pulled out of the record from previous data just for simple comparison purposes. So this is the lifestyle section, and if I move further down, you can see here the asthma control test score is represented graphically. We obviously calculate the score, but we're not interpreting it for you. We're not telling you, and we haven't told the patient what it means. We're simply giving you that information. And then we won't look at it because of time, but the patient responses down here, if they've been entered free text, is in a slightly different font here, and anything that might highlight a need for some input is highlighted in bold as well, similarly with previous information here on the right. Where physical checks are relevant, so not here, but let's say in a diabetes response, we actually show all of that information, and in terms of the blood tests, the urine ACR, foot check, and blood pressure. And so that allows you to have all of the information in one place. So you can see here, these are the results for this review that's happened. We also pull out previous results from the record as well, and we traffic light them based on the lab supplied reference ranges as well. So moving back to the asthma response here, once as a clinician I've looked on the left hand side at all that patient information, I then need to carry out my clinical decision. And so on the right, that's all built into one place. I can send a message to the patient here. I can write my own content, or I can use a template to avoid having to type the same thing out regularly. I can edit the asthma action plan, which is an important part of asthma reviews generally, and so we add into this section relevant condition-specific things like that. I can add other attachments to that. For example, here there's an asthma. We might add an asthma attack recovery plan or a steroid card, for example, here. Below that, I can write a comment for the record, which is something that gets written into the record but doesn't actually get sent to the patient. And I'm also able to arrange a follow-up appointment for the patient if they need that. And so the way that looks is that I'm configuring an appointment self-book link. And so this is a link that goes out to the patient with my message that allows them, just that patient, to book into a single appointment of the type that I specify. So you can see here I can specify the appointment type, whether it's a single or a double appointment. I can choose the slot type, and so our system pulls all of your slot types directly out of Vision. I can say any clinician, or I can actually specify the clinician as well, and I can write here a booking reason and booking notes as well. And the system automatically, once I've selected those, will actually check within your Vision system and ensure that what you're sending out to the patient does actually have appointments available. Because the last thing we want to be doing is sending out appointment links to patients that won't actually allow them a combination that simply doesn't exist. And so that's just a way of allowing your patients to book directly into a follow-up appointment without having to call the practice. They can simply do that online. And the same system is available for the physical check appointments that we looked at earlier. So comparing these two options, AutoCode and email has less functionality but is very simple to implement. The inbox comes with messaging, built-in patient messaging and comment and appointment booking, and so has significantly increased functionality. But whichever option you choose as a practice to use, and you can do that both at condition level and actually by clinician level as well, that data all gets written directly into the into the vision record without any manual input whatsoever. So you can see here what that looks like within Vision. This is just a section of one of the automatically coded pieces of data. We don't actually control the order, that's done internally by your own Vision system. But all of the coded data that goes in, we actually put in the document as well, both the summary document that you saw earlier with all of the patient information, including the free text, and we put in things like the asthma action plan and any other attachments that you've attached, as well as the clinician comment and the details of the message. And so the beauty of using the MedLink inbox is that this entire process happens without any admin input whatsoever. The only manual part of the process is your clinicians logging into the inbox, looking at the patient responses, deciding on the outcome, and then filing all of that data to the clinical record automatically. So what's the impact overall in the practice? Well, what we found with the online reviews is that it really releases clinical capacity. It allows you as a practice to essentially risk stratify your patients and to be able to identify those perhaps at the lower risk end of the spectrum who can be very safely managed with a remote review, and even where follow-up is required for patients. What it means is that the patient's already answered the question, you've got all the data coded to the record, and actually your clinicians have already identified any areas of concern, and so it makes for a very efficient follow-up consultation. All of the communication costs for sending out the email and SMS invites, as well as the follow-up messages to the patient, is included in the overall cost. And the big impact of the automated recall system is that you can run your entire recall system without any clinical system searches or having to manually arrange any invitations. It's all run fully automated without any manual input other than that initial setup. We tried to price MedLink in a way that we hope is attractive and is not a barrier to any interested practices. So the annual subscription is 11p per patient plus VAT. That's based on your practice list size. And if we just look at the graph here, the released clinical capacity by comparison, it gives you a return on investment of around 12 to 13-fold of the value of that clinical capacity based on some registration details that you give us. We've not actually included in that graph the admin saving. It's a more difficult metric to really nail down. And we do have some contracts with clusters, HSCPs, and health boards, and so there are some discounts available for bulk contracts. Word of mouth is always the best way of the word about MedLink spreading, and so we encourage a referral scheme whereby if you refer a fellow practice and they sign up to MedLink, then it adds it adds a month to your year's subscription, just as an incentive. There's lots more information available on our website, medlink.co.uk. You can get in touch with us, info@medlink, and we'll be very happy to answer any questions. If, as a practice, you'd like a demo session, then that's very easy to arrange via Teams, and either myself or one of my colleagues would be delighted to do that for you. I hope that's been a helpful session. Please get in touch if you have any questions. Thanks very much indeed.